Hi friends, I wonder if I'm the only one who feels like the world's gone completely mad. Chinese scientists have discovered something many people feared but preferred not to admit. Internet addiction damages the brain no less than drugs or alcohol. According to the BBC researchers' analysis, brain activity in 35 people aged 14 to 21. The results were alarming. 17 participants identified themselves as internet dependent. They honestly answered yes to questions like, do you try to reduce your time online and fail? Brain scans revealed damage to the nerve fibers connecting regions responsible for emotions, decision making, and self control. In other words, the internet begins to rewrite the brain in a way that undermines its ability to regulate itself. British professor Gunther Schumann noted that video game addiction produces very similar effect. This suggests that digital environment is not merely entertainment, but a factor that literally disrupts fundamental mechanisms of thinking. At the same time, other studies show that feeling of power and authority can influence the brain in an opposite direction, making it more focused and analytical. Professor of social psychology Lee Yoon-yin from Queen's University emphasizes that a person's mindset is a flexible system that can be reshaped. But she also noted that much depends on cultural context. Where self-discipline and control are valued, the brain adapts. Where digital pleasure dominates, it gradually weakens. This experiment is not just a set of dry numbers. It is a serious warning. Humanity has reached a point where virtual addictions began to rival chemical ones. And if society continues to treat this note seriously, future generations may develop brains that can no longer distinguish between their own will and the algorithm governing their attention. The story of Samantha Lawrence from Worcester, UK, looks like a sad illustration of how a craving for soft toys can lead to some very hard consequences. Walking into a store, the woman suddenly felt an irresistible pull towards plush Jellycat toys, the things that usually inspire affection but not criminal changes. Samantha didn't bother with subtlety. The fluffy creatures went straight into her bag, and when there was no more room there, she moved on to stuffing them onto her own trousers. Apparently, she decided the toys would feel cozy there. The total fluffy haul arounded to 650 pounds, enough to buy the entire warehouse of these cuddly creatures. But the plush heist plan split at the seams like a poorly stitched teddy bear. Security camera easily recorded everything, and soon the police knew the name of the woman with the unusual hiding spots. In court, Samantha got away with a fine and compensation to the store, avoiding prison. Her lawyer insisted that depression and a whole cocktail of antidepressants supposedly pushed her toward that strange behavior. However, the real punishment turned out to be far less official. The video of the theft quickly spread across social media, and the online community tore Samantha apart in the comments like if a kitten shredding a sofa. The woman admitted that this wave of online shaming hit her harder than the court verdict. In the end, the plush kittens and bunnies became not a cute comfort, but a symbol of how even the softest toy can lead to some very hard public humiliation. A tragedy has occurred in the United Kingdom, calling into question the basic professionalism of the whole medical system. 77-year-old Amy Francis from Newport died at the Royal Gwen Hospital after a surgeon attempted to remove her liver instead of her cancer-affected right kidney. Considering her age and underlying conditions, the operation was supposed to be performed using a minimally invasive endoscopic method, so-called keyhole surgery. At first glance, nothing complicated. A small incision, removal of the organ, a routine procedure. Consultant urologist Adam Carter even decided to entrust the key moment to a trainee doctor, as if it were a practice dummy rather than a living person. The result of this training session turned out to be horrific. The trainee began the procedure, noticed something strange, and instead of stopping and calling for immediate verification, simply stepped back. Carter then took the instruments himself and, confidently grabbing the organ, pulled sharply. The organ he somehow managed to confuse with the kidney turned out to be a part of the liver. The patient immediately experienced a severe drop in blood pressure and massive bleeding began. Surgeons rushed in to save her life, but it was too late. Forensic experts diplomatically described the incident in the final report as unintentional liver damage. In reality, it was a blatant ignorance and unacceptable overconfidence in the operating room. Yes, the family of the deceased accepted the official findings with dignity. Yes, the son thanked the doctor for his honesty, but the essence remains appalling. An elderly woman was entrusted to an unexperienced trainee, and a qualified surgeon failed to distinguish a liver from a kidney. Only after this tragedy they did review the case and modify the surgical technique. In other words, the patient became a victim of unprofessionalism first, and only then the doctors did decide to learn how to operate properly. Australia has finally taken a step long awaited by everyone who cares about those fluffy eucalyptus munchers. A chlamydia vaccine for koalas has been approved. Yes, it sounds like a tabloid joke, but this disease is the biggest threat to those cute, sleepy creatures. Previously, the poor animals were treated with antibiotics, but the side effects were worse than the illness itself. Koalas began to struggle digesting eucalyptus, the only food. It was a sad choice: treat the infection or leave the patients hungry. Scientists from the University of the Sunshine Coast spent 10 years working on the vaccine, conducting endless trials to save the population from extinction while avoiding a mass diet caused by medication. And now the vaccine has finally passed all tests and received the green light. Soon fluffy patients will be vaccinated everywhere, from veterinary clinics to the wild, where a doctor in a white coat is unlikely to appear, but a syringe certainly will. The project's lead scientist, Sam Phillips, proudly reports that the vaccine reduces mortality by 65%, prevents the disease from developing, and can even ease existing symptoms. Well, now koalas have a chance not only to sleep adorably for 20 hours a day, but to do it without fear that nature will throw a bacterial curveball at them. Australia has once again proved that if anyone deserves to be saved first, it's those eat lovers and look at the world with the eyes of round, plush angels. What do you think about it? I'm really curious to hear your thoughts, my friends. Share them down in the comments. I'll be reading them all.